Pardon? I'm sorry. Go ahead.
Sandy Magnan from ICSI and a member of the Roundtable. So we've talked about these two things of education and jobs. And there's some combination of that. We've talked about, boy, if we could take money out of the healthcare system and invest it, where would we get the greatest impact on health? And so I'd love to hear your perspectives, particularly if you've talked about, Farad and Carla, about education and jobs. What's that balance between those two? You know, how much should we be focusing on education versus job development, or there's this tango between the two? So that would be my first question. The second question is, what you're doing is so important to population health. What could we do on the roundtable that would help people like yourself succeed and be successful in that human capital development that you're doing?
These are some big questions. I mean, I think this session and whatever flows out of this on your second question is what is could be very powerful. I think the question being asked here is, can business have a more powerful impact on population health? And I think the answer to that question is yes. And I think Ray laid out a lot of leverage points beyond, you know, a grant or something like that, but really core to the business. Procurement, supply chain, human capital policies, et cetera, investment policies, that all could make a huge difference. So I just think giving credibility to the notion that business can have a huge impact on the health of the people in the community by thinking about these practices, just drawing that line together from a credible institution like IOM, I think that's very, very important. And on the education jobs piece, I mean, I guess from my perspective, I think we suffer often from, you know, kind of silver bulletism. We like one thing to, you know, and particularly I think in the Bay Area, maybe with high tech, we'll have one app and it's going to solve all of our problems. So, you know, it's an unsatisfactory answer perhaps, but I really don't think this is sort of an either-or issue. I mean, there's absolutely no question that having a good education and taking people as far as they possibly can go in the education system is essential. So we need that. And we all know, and I think we both spoke to this, that there are a lot of people who are struggling in the education system as we know it, and in the communities that they live in a way that makes it hard for them to get through school. And for many of them, employment, employing more of the people who live in those communities that they live in would address some of the violence and dysfunction that makes, you know, it very difficult for them to get through school. And for some of the young people who are in school who have economic responsibilities to their family, and would do a lot better if we can draw a much closer tie, as the project in Durham is doing, between what they're learning in school and their potential to work, or actually allowing them to work as they're going to school. So I think we need a lot more flexibility with that. And I just, maybe just to make one other comment, I just think that the country has sometimes disparages people who are doing work that may not be very well-paid work in a way that's not beneficial for any of our communities. And that, yes, people are interested in getting paid well, absolutely, but people also want dignity and respect. And if we act as though a lot of the jobs that people have to do are not worthy of dignity and respect, I think that makes it also difficult, for the people who are in those jobs, and to fight for the proper pay and benefits for people who are in those positions.
Ditto. Terry.
Thank you very much. First, I wanted to extend in advance my condolences to George on the anticipated loss of his Golden State Warriors at the hands of the Cleveland Cavaliers tonight. So, my condolences. I had the mic, so. Terry Allen from Cleveland, Cuyahoga County Health Department, and also NACHO and the Roundtable. Thank you very much for your presentation. And George, I wanted to, listening to your presentation and slides, I started thinking about the maps that David talks about all the time that haven't changed for many decades during his career. I started thinking about, you know, the idea that we all, certainly all pay for poor health, and that the narrative is very important, because I find sometimes it can seem to be more political, and that it can be a conversation stopper, depending on who you happen to be talking to in the halls of Congress or where you may be. And I know that RWJ has looked at some of these issues over time. I'm wondering from your standpoint, what is, as we think about perspective transformation, what is the narrative that you find, or all of you found, resonates sort of above politics, that matters, sort of what matters to America in terms of opportunity for everyone? I wondered whether or not you feel strongly about a narrative that has worked for you.
So we're embedded in a place-based approach. And if you consider a place, community, or neighborhood, everything that goes on in that place matters in terms of prosperity. If it erupts into violence, if it erupts into failures, then everybody suffers in that place. So our saying, or our slogan is "Health Happens Here." That it's a very place-based slogan that lets people know that you can make health happen, or you can destroy the occurrence of health based on what your practices are, what your investment is, or lack thereof. And I think business has a very, very important piece of that place-based approach, because they're part of the community. They're part of that place, and they draw that their employees from the place. They use the resources in that place. They may use the other businesses in that place. Their customers are in that place. And to us, it means that the business should therefore consider its own interest in being served by the welfare of that place.
Thomas Levis from Johns Hopkins and member of the Roundtable. And so I want to ask a question that goes back to a question that was previously asked, but I want to take a little different spin on it. And it's related to actually what you just said about health happens here. So the question earlier was about whether or not these programs, whether there's any evidence of health improvement from these programs. And I know, George, you talked about research showing correlations between employment status and health status. Of course, we don't know what the causal directionality is. We don't know that it's maybe healthier people are better able to get jobs and hold and sustain those jobs, but not that employment is producing the better health outcomes. So, but I want to ask the question not from an individual level, but from a community or a population level. And ask either of you, in your experience, is there anything that you've seen, even if it's just anecdotally, that might suggest that the work you're doing will improve the health of the community in general? So when I'm saying that, I'm talking about not the individual that gets the job and who has health insurance and is able to get screened and maybe do better, but any evidence that suggests that maybe the health statistics for that place, that community that you're working in, may actually begin to improve as a result of that work. And then I have a follow-up I'd like to ask, if I can.
Yeah, I think that's a good question. I don't have any scientific experiment that I can give you to refer to, but I will say that what I found out is when minority businesses are doing well, they tend to hire more minorities than any other group. Women hire women, minorities hire minorities in all those spaces. And they seem to have an affinity for understanding what is needed in their communal, familiar space. So I tell people, I can go to a community and I know how to hire maybe that unemployed person or that person who's, has some recidivism or something, because we may know some of the triggers. I may know his aunt. I may have grown up with him. I may know some of the other factors that help to build his structure, his own structure. So that helps to build his sense of dignity. And once you can build a community sense of dignity and pride, I think you see a reflection that's very different. So when we have disinvestment in our communities from grocery stores and banks and all the things that we pull out, and then we throw in things that are predatory, then you seem to have a more unrest in communities. When you bring back employers who care about the community and invest in the community financially, with resources, or with time and commitment, you see there's a more familiar responsibility and respect for what happens. So the goal is that how do we build better businesses for the community and people to lead those businesses so they could be a reflection of this can be done, we know someone to do it, because we also know that minority groups are more philanthropic in their communities than any other group too, because you got to watch kids, help someone here and there, but that's not as measured as you would be if you were in a community foundation. So that's what I believe.
Agree, and I mean, I think what we've seen that has an impact on health is reduced incarceration, reduced homelessness, increased housing stability, increased connection to children, dependence, and visibility of people who are working legitimate jobs in a community where there may not be so much visibility, that in turn has encouraged others to get involved. So I think that's the best evidence we've got.
Is there time for a second question?
No, actually, we do have one of our panelists needs to leave, and I'd be glad to have you ask one of us individually afterwards.
Sure.
That would be great. I want to thank Carla Javits and Farad Ali, and thank all of you for this excellent session. Thank you very much.
Thank you. Thank you.